So homeostatic imbalances can lead to disorders, disease, and death eventually. So a disorder is going to be a general term of any abnormality. Disease is going to be definitive signs and symptoms. And death, of course, is the stoppage of life. All right. So disease, we have a little bit of distinguishing characters again. The symptoms, these are subjective. So this is more of a clinical note. The subjective part of this, the symptoms, are going to be something like nausea or anxiety or headache. There's not anything you can really test for, say, nausea. You don't have any kind of meter or scale for that. Signs, on the other hand, you have a specific way to test this, so they are objective. So, like blood pressure, you can take a person's blood pressure and say, okay, it is too high or it's too low. So that is the difference between signs and symptoms. All right, so now we get into the actual anatomical position and getting more into the human body now. All right, so anatomical position here, you are facing forward, head is level and eyes are forward, lower limbs are parallel, feet facing forward, arms or upper limbs are at your sides with palms facing forward. Now, this is one thing that most people don't think of because naturally, anymore, palms either face the side of your body or posteriorly, meaning behind you. This is not the case for anatomical position. So this is correct anatomical position. So the reason why we need to note this is because when we start to go through class, you're going to need to know this when it comes to knowing if something is lateral, medial, proximal, distal, superior, inferior, anything such as that. So if I asked about what part of the hand is anterior, meaning what part of the hand is the front side, that means the palm is. So if you were, if you misunderstood anatomical position, you might think I meant the back of the hand, which is not the case. Okay, all of these that you see here on the screen at the moment, they are good to know because we will be making references to those as we go through the class. Now, speaking of references, terminology. These directional terms are very pertinent to class because we will be using these on a weekly basis, on a daily basis. So knowing superior is toward the head, inferior is toward the bottom or away from the head. You need to know the difference between those. Anterior is going to be the front, posterior is the back. Medial is towards the midline of the body. Okay, so most medial part of the body and the stomach is going to be your belly button. And then lateral is going to be towards the side of the body. Intermediate is just between two structures. Okay, ipsilateral, contralateral, those aren't going to be used too often, but ipsilateral means on the same side. Contralateral is the opposite side. Internal, external, we usually use these in our daily lives anyway. So internal is going to be something deep, so away from the surface of the body. External is going to be towards the surface of the body. Proximal and distal, these are pretty specific to our appendages, our upper and lower limbs. So proximal means closer to the center of the body or the point of attachment. So more meaning it is closer to the shoulder. So the elbow is proximal to the wrist, meaning the elbow is closer to the shoulder than what the wrist is. Distal is just the opposite. The wrist is distal to the elbow, meaning it is farther away from the attachment point. Okay, then visceral and parietal, we'll see these. Visceral is going to be related to internal organs, and parietal is going to be related to body walls. Okay, just a little bit longer. So here we see some pictures of all of those directional terms. It would be good to know. All right, planes of the body. There are three specific ones that I want to pick out here: sagittal, frontal, and transverse. So sagittal is vertical plane that divides the body into right and left sides, or the organ into right and left sides. Frontal or coronal will divide the body into anterior and posterior portions. And then transverse is going to divide the body or an organ into superior and inferior portions. So here we have a picture of where those planes would be running through the body. So take a good look at those, make note of those, and know them well. All right, body cavities. Here we are really going to be focused mostly on the thoracic and abdominal pelvic that we'll see most throughout the time in this class. But cranial is going to be housing the brain, so it is very specific. Vertebral canal, again, very specific, housing the spinal cord. Thoracic cavity, we are broken into 3 different other cavities that are going to house different parts of the body. Pleural cavity surrounding the lungs, and as you'll see, anything pleural is going to deal with the lungs. Okay? And then pericardial, that was a terrible line. So pericardial, cardio is dealing with the heart. So it is a specific cavity surrounding the heart. And what is left is going to be the mediastinum. So we're going to see this is in between the lungs, the space between the lungs. This is going to house the heart, the thymus gland, the esophagus, and the trachea. That is a beautiful line if I say so myself. All right, the abdominal pelvic cavity, split into the abdominal and pelvic cavity. Okay, the abdominal cavity will house all the abdominal organs, and the pelvic cavity is going to house the reproductive organs, urinary bladder, and parts of the colon, the sigmoid colon and the rectum. Here is a picture of those. So here we have cranial, again, housing the brain. The spinal cord will be housed in the vertebral cavity. Thoracic cavity, you'll see here, split into different cavities. So we technically have 2 pleural cavities, 1 for each lung. The pericardial cavity, housing the heart, and the mediastinum includes the pericardial cavity and the rest of the organs left between the lungs there. Okay, abdominal pelvic, so the abdomen. So we see most of our digestive system here, and then our pelvic cavity. Okay. All right, so these are boundaries. You are not going to be questioned on the boundaries. You do not have to know these verbatim or anything, but this is another way to kind of give you an idea of where to find these cavities. All right, within these cavities, we do have membranes. These are serous membranes that are going to be found in there. They're going to be slippery, double-layered membranes, and this will help decrease friction and help with protection within these cavities. So the 2 layers are parietal and visceral. We just went over these terms if you'll remember. Parietal is going to be the thin epithelium that's going to line the cavity walls. The visceral, so dealing with the organ within that cavity, is going to cover and adhere to the viscera within those cavities. So the parietal layer of the pleural cavity will be on the inside of the chest wall or the inside of the rib cage. The visceral layer will adhere to the lungs. So 3 types of serous membranes that we see: pleural, pericardium, and peritoneum. Just know where they are found. So pleura is going to be found in the pleural cavity. That's supposed to have an L right there. The pericardium is going to be in the pericardial cavity, and the peritoneum will be found in the abdominal cavity. So this is a very large serous membrane that we'll discuss when we get there. All right. Last but not least, abdominal pelvic regions and quadrants. If anything, we will focus on the quadrants. So this is a way to divide and locate areas in the abdomen or the abdominal pelvic cavity. We'll just head straight to the picture. So different regions. We've got right hypochondriac region. We've got left lumbar region. Again, you really won't be tested on this particular section here, but knowing right upper, right lower, and left lower quadrants, this is where I could ask, where will you find the appendix? The appendix is going to be found right here in the right lower quadrant. So that is why those will be good to know. So that is the end of chapter 1. We will see you again for chapter 4 on the tissue chapter.